Going to be talking about a very rare piercing today, transverse lobe piercings. Going to give you the pros and cons of that, the advantages, disadvantages. Also going to go through what you should know beforehand, getting the piercing, healing the piercing, jewelry, and living with the piercing, and what happens if you don't want it anymore and take the jewelry out. Coming up next on Pros and Cons by Piercer, Season 2, Episode number 92. For those that are new to the channel, welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos. Hope you're finding it helpful and useful, but you may not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio, located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So what we're going to be talking about today is a very rare piercing. It's not one that you see very often, and it's not one that piercers do very often. Basically, instead of going through the lobe like we normally do horizontally, we go through it transverse, which is lengthwise. Done with a curved or straight barbell, depending on the shape of the ear. It's one of those piercings that you really need to find somebody that has the experience and expertise to do it. This piercing is a modern invention, of course. It is credited with Sean Larratt. I believe I'm pronouncing his name, or Larratt, who was a founder of Body Mod Easing, which I never go to anymore. I don't know if it even exists anymore, but was at one point the most comprehensive Wikipedia involved documentation of body modification on the internet, worldwide for that matter. There was tons of information, things you wouldn't even, of course, body piercing and tattooing, but also a lot of more extreme elements of body modification. In ritual and etc. Lots of great information there. Yeah, just one of those things that if it's still there, you want to probably check it out, but do it with caution. With that out of the way, let's go into the pros, the advantages, the things that make you go, yeah, I need that in my life. Starting with number one, it is a very unique and rare piercing. It is not one that you're going to find very often. You're not going to go to a party and 8 other people have it. It's extremely rare, and there's a reason for that. Basically because you have to have the right anatomy, and you have to have a piercer that's skilled enough to do it. Number two, it fits well into the anatomy. It can really accent and it does kind of a trick of the eye kind of thing to it. Can really enhance it depending on the ends. You can do a lot of variety of different ends to kind of bring attention to it. It kind of is one of those piercings that it's going to be a conversation starter. Unlike a lot of experimental or edge piercings, this particular one does have a long history of healing and being performed correctly. It's not one of those things that like everybody that gets it done, 1 out of 10 it heals and 9 of them fail. Number 4, most people say this hurts less than a traditional lobe piercing. I don't know how that is. I don't know if it's partly because the people that are getting it done tend to be more on the heavily modified, so have a little bit better pain experience of how to deal with it, but most people say it doesn't hurt as much. There is a large variety of different ends and jewelry that you can put in this to change the look of that piercing. There are thousands upon thousands of ends that you can put on curved barbells or straight barbells to give it a very unique and personal touch. Now it's time to move on to the cons, the disadvantages, the things that make you go, nah, I don't need that in my life. Starting with number 1, this piercing is very slow. It cannot be done quickly. You are going through a very long length piercing. It has to be done very precisely, so it's not something where we can do it as quickly where we're just going through a thin piece of tissue. So it takes a little bit longer for that needle to get through. Number 2, much longer healing time than you're going to see with most other ear piercings. This thing can take a very long time to heal. Number 3, the risk of migration or rejection. If this thing isn't done dead center, right where it's supposed to be, it can migrate this way or that way, or partially on one side, etc. It does have that risk. Number 4, This one is prone to abscesses because it is such a long piercing. If an infection does develop, sometimes it can develop very deep into the piercing, and because your body can't push out that infected tissue, it will create an abscess by isolating the tissue, and then in theory, hopefully push it to the surface, but in some cases it can't, so it may require medical treatment. It's also kind of harder to monitor infections with this or treat them. So keep that in mind, that if you start seeing issues with this piercing, address them immediately. And the last one, number 5, can close extremely quickly. It is really easy for your body to collapse this piercing and start sealing it up in a matter of a couple hours. It's really one of those piercings that you only take the jewelry out to put another piece in. Now, preparing for the piercing, or what you should know beforehand. This is an extremely advanced piercing. This is a piercing that you really need to find somebody that definitely knows what they're doing, has a lot of experience doing this piercing, and this is not a new thing to them. It is not uncommon for this to be a piercing that a piercer has never done before. That's really common because it's extremely rare. Second thing you want to consider is it may prohibit you stretching earlobe piercings because there may not be room for it, or it may impact the transverse lobe piercing and cause it to reject or migrate. You definitely, it's kind of one of those things where it kind of limits what you can do in that area in the future. If you're employed or involved in some type of organization that has a dress code or maybe competes or what have you, there might be a situation where you need to remove the jewelry to participate. You need to find that out beforehand, because nothing sucks more than going through the trouble of getting a piercing, starting that healing process, and then going into practice or your work or what have you, and them saying, okay, you either take that out or you're going home and you can't do this anymore. I already mentioned this, but the piercer needs to be extremely experienced with this piercing, professional, informative, be willing to do consultations without being asked, be very much into the vein of educating you to the risks of this particular piercing, understanding if your anatomy is going to work or not, and just be very open and answer any questions that you may have about the piercing or their skills. That should also cover a basic rundown of what it's going to take to heal the piercing, including the length of time, basic methods, and cross-contamination prevention. Also, you need to find out if the piercer supplies aftercare products. If they don't, you might want to go out and purchase that in advance so you don't have to deal with it. Also, do they give aftercare instructions verbally and in writing so that you know clearly what to do after you've got it done to heal it properly, and if you forget about something you can reference in the future. The next thing is the piercer should offer jewelry that is a third-party certified, biocompatible material. Since this piercing is more prone to migration and rejection, having the correct metal that is biocompatible and your body's going to accept is extremely important. So, high quality, biocompatible jewelry. Ask about their jewelry. Just be nosy. This piercing is going to demand that you isolate it. It's also going to demand that it has little or no contact. Plan ahead. Workout routines, get a game plan of how you can avoid contact with the piercing. If you're involved in any type of activities or hobbies that involve headgear or helmets, you may want to consider doing this when you aren't doing those things, just to give that piercing a little time not to get knocked around a lot. If you are somebody that sleeps on that side, you need to take precautions to figure out a way of either sleeping on your other side or isolating or elevating the jewelry off the bed. This piercing may take as much as a year to heal, maybe longer. It is a slow heal because it is so long. So do plan ahead with that. This piercing should be done freehand. It shouldn't involve any type of forceps or clamps. It should be done pushed using hands. When you're going through the consultation with your piercer, discuss any future plans you have for additional ear piercings in the area. It's a good idea to kind of understand what's going to be possible and what may be possible and what is completely not going to be possible before you get the piercing. Then come back later and go, oh, I can't get that? You didn't say anything about that. I'd always planned to get that. Do these things ahead of time so you have a game plan of what that ear is eventually going to look at, and you can achieve that look that you like or want. Last one is you have to have the correct anatomy. With these, if your earlobe is attached, can't do it. It needs to be kind of more lobe-shaped or out away from the face and be able to be pulled separate. Otherwise, you're not going to have an entrance and exit. Some are better options than others. Some earlobes are partially attached. They're not attached all the way. Some are completely open. That's going to dictate not only whether or not the piercing can be done, but what type of jewelry is going to be needed to do it. Now let's talk about the piercing experience itself. Most people, like I said, say this hurts less than a normal lobe piercing. However, I have to say that just because of the length of period of time it usually takes to do this, I'm thinking this is closer to a 4 to a 6, though I've had people say it's a 1. So it really depends on the person, and let's face it, regardless, some people are wired differently than others when it comes to pain. First thing you should expect is a consultation where the piercer will go through basic aftercare, cross-contamination prevention, any steps you need to take to isolate the piercing, establish whether or not your anatomy is correct for the piercing, selecting jewelry, suggestions, etc. Once that's done, we'll usually bring you back or have you fill out the waiver in the waiting room. Once you're done with that, come back. We start setting up and disinfecting. First, we set up all our tools that we're going to need. Then we will disinfect the area with a surgical scrub, such as providite iodine or PVD or betadine. Once that's done, we will mark the piercing. Now, we usually use a type of ink that is very biocompatible, but also tends to stay on the body for a long period of time. So don't be surprised if you're going to have some markings left over when you leave. We try to clean them off when we can, but sometimes they just won't come off. With this one, you're going to probably see a line to kind of guide the path that the piercing is going to go, and then dictating on each side the entrance and exit. Do look at that and assess it. The piercer should have already measured out the area and figured out what's the best length of the jewelry for the barbell and everything else. But that's what we, once we mark it, take a look at it, verify that it's what you want and where you want it. Then we move on to the next part. After it's marked, you want to go ahead and take a look. You might, because where it's located at, it's kind of sometimes hard to see exactly what the angle is depending on the shape of your ear. You may want to have a friend take a phone and take a photo, or take a photo with your phone, just to get a clear understanding of exactly that mark is exactly where you want that piercing. Now, with this one, the way you want to do it, or the way we do it, and I'm going to try to explain this, is we grip the lobe kind of like this so that we can tell where, kind of get a guide of where that needs to go. Just very lightly grip it and support it as that needle goes through. The easiest way I know how to describe this would be if you've ever put a meat thermometer in like a fairly thin steak. You kind of have to be careful because you don't want it to go this way or that way. It needs to be direct, and you need to kind of support that tissue. Otherwise, it'll kind of sponge up or thin out, and then you don't know exactly if you're in center or off center, as we generally try to do these. A little bit off center to avoid that piece of cartilage that's in the center. It's a slow piercing. There's just no other way to do it because it has to be so precise. This will be done either with a curved barbell or a straight barbell. If there's a way to do it straight through, I think they're a better option. If it needs to go kind of a little bit in the bottom and up to the top, then a curved barbell is going to be a much better option. Once that needle is through, we take a guide pin with the jewelry, push the jewelry through. screw on the end or press the end in, and then stop any bleeding that may occur. Usually these don't bleed a great deal. Sometimes they do. It really varies from person to person. Usually right afterwards, you're going to notice a little bit of throbbing and aching. That will last a few minutes. Then it's just going to be kind of tender to the touch. If you bump it, you're going to know it. And that's your body telling you, leave me alone, stop messing with me, avoid that contact in the future because I'm working here. Jewelry will be a bit on the long side to allow for swelling. It's very important that that isn't super tight because the piercing may swell. These usually swell a little bit, and it's better to have it a little too long than too short. Now let's move on to healing. Average healing time on this is anywhere from 6 to 12 months. Cleaning twice daily using a sterile saline spray. My personal favorite and what we stock here in the shop is Neomed's Piercing Aftercare. Comes out in a fine, lovely mist. But if you can't find that, there are other products on the market that will work. The main thing you want to look for is it needs to be in a pressurized metal can, not a one of those squirt bottles they have to pump, or a pump bottle, or a refillable bottle. It needs to be in a metal can under pressure. When you turn it over, it should say sterile on it. When you turn it over on the back and read the ingredients, it should only have purified water and sodium chloride. Now, the nozzles on these can vary a great deal. With Piercing Aftercare, and the reason why we like it so much is it comes out in a fine mist. So you just mist both sides of the ear really well, let it stay in contact for about 5 minutes. If it comes out like a squirt gun, that's not really going to be that easy to do and kind of messy. So what I generally suggest is do a cold compress. Take a sterile piece of gauze sponge, soak it up to the point where it's damp, lay it against the area for about 5 to 10 minutes. You want to do either of those twice daily. The other thing I suggest, at the end of your shower, pull your hair and everything out of the way, and just let the water flow over the area for about 30 seconds. What we're doing with these two things is removing that discharge that hardens and collects and deposits on the jewelry. The reason we want it off is when the jewelry shifts or moves, it can agitate it, it's very uncomfortable, and it could possibly lead to problems. Now, if you have a little bit left over after you've cleaned it, it's not a huge thing. It will probably come off the next time you clean it. Do not run to the medicine cabinet and start pulling out everything tipped in cotton or with a sharp point and start digging around because the discharge isn't coming off. See your piercer, have them take a look at it, and have them clean it for you if you can't get it off, because there might be something else going on that you need to address. Swelling will last anywhere from 3 to 5 days. You can greatly reduce the amount of swelling by avoiding contact with the piercing as much as possible, isolating it. Also, sleeping with your head elevated above your heart will help reduce swelling. You can take over-the-counter anti-inflammatories if you've never had issues with those. If you're in doubt or never used it before, you might want to talk to your medical professional before taking it, especially if you're on a lot of medications. There's also, for like home remedy type stuff, CBD or CBV, I can't remember. Talk to somebody that actually is in the business. They'll probably give you the best answer. It can help with swelling. I don't suggest the oils that you pour directly on the area at all. Do not use that. I'm talking about taking something orally. Practice cross-contamination prevention. All of this is common sense stuff Mom should have taught you. Wash your hands before you handle it. No oral contact or exchange of bodily fluids on or around the piercing until it heals. Keep your environment clean. Clothing, bedding, towels, anything that comes in contact with it. Do not submerge the piercing in bodies of water you cannot control the quality of, which is everything but your own clean bathtub. Keep pets away from it. Don't let them sleep in the bed with you. Especially those smaller animals like to sleep on your pillow up by your face and steal your soul and breath while you're sleeping. Also, avoid contact with unclean objects. Culprits would be things like over-the-ear headphones, hats, helmets, towels, helmets. I said helmets twice. Must be important not to do that. Completely avoiding contact is your best option. If that's not possible, then I would suggest at least disinfecting the whatever item it is constantly, just to ensure that you don't transfer something to the piercing. When it comes to abuse, avoid sleeping directly on the piercing. Make sure you're sleeping on the other side or your back. If you cannot sleep any other way than on that side, get a U-shaped travel pillow. Sleep in the center of it, and to keep it clean, just put a clean tube sock on it every night. Also, make sure your hair is dry before it comes in contact with the piercing. Wet hair can cause infection and other problems because of all the moisture. Avoid playing with the piercing. It's a natural human instinct to play with anything that's new. Just touch it, touch it, touch it, touch it. Don't do that. You're going to just increase your likelihood of infection and other problems. The only time you need to have contact with that piercing is when you're checking the tightness of the ends to make sure they're secure. I suggest doing that at least once a week. Other than that, leave it alone. In other words, don't spin it, don't rotate it, don't move it, don't hang things from it. Do not floss with it. Leave it alone. First 3 to 5 days, you're going to see swelling, of course, but you also might see some redness, discolorization, heat, tenderness to touch, and maybe a little heavier discharge for about the first 3 to 5 days. So it's not uncommon to see a tad bit of bleeding off and on during that period of time. If it continues, figure out exactly when it happens. If it happens first thing in the morning, chances are that you are doing something in your sleep, either rolling over on it or moving the jewelry in some way to cause it to bleed. So try to adjust your habits for the future to avoid that. Piercing always needs to be monitored for issues. With this one, you kind of once a week or so kind of feel in the center of that piercing. If you start to develop a large bump or a pocket that feels full of fluid, seek medical professional advice or at least go to your piercer. Also, monitor any signs of rejection or migration. Migration is where the piercing just slightly moves. Rejection is where it moves and then it starts pushing out of the tissue. Usually when you start to see rejection, and the main difference between the two is with rejection, the area around the piercing will get very scaly, dry, and look like it's almost splitting open, like the skin's too dry and it's cracking. If you start to see that, see your piercer to verify, and then about all you can do is remove the jewelry and let it heal over. Now let's talk about jewelry. Jewelry should be made, of course, of a biocompatible material. Regardless how well healed the piercing is, it is always best to put in jewelry that you're not going to have an allergic reaction to. If you are sensitive to metals and etc., you need to go and take the extra steps to make sure that the jewelry that you're buying is in fact certified by a third party to be biocompatible. Do not be fooled by this idea of hyperallergenic. All that really means is that it's less likely to cause a reaction, which means some of the materials that you are actually allergic to is probably in that jewelry in a very, very small amount, but probably enough to cause a reaction. The other thing is make sure you're only using quality jewelry. With this one, jewelry needs to be left in at all times, only taking out to replace. In fact, I would suggest probably your best option is go see your piercer, have them change it. With these, it's best to change with a guided or a guide pin, either threaded or threadless, so the piercing is never completely empty. If you have threaded ends, check those ends on a weekly basis. Pick a day of the week, and that's ball checking day. And just ball check every week on ball checking day. Should be a national weekly holiday. If you have a medical situation that's going to require removing the jewelry for a period of time, if you can find jewelry that's long enough, a good substitute would be glass. They come in curves and they come in straight. The problem is having something definitely long enough. Once the piercing has gotten to the point of roughly about, on this one I would say 6 to 8 weeks, maybe 4 weeks, especially if you're catching it on things, shortening the jewelry to something that's a tighter fit is your best option. Do not wear loose-fitting jewelry and piercings for a long period of time. You're just increasing the likelihood of problems by it getting caught. Now let's talk about living with the piercing. Of course, already talked about it. You want to check your ends on a regular basis. It may impact future ear projects or earlobe mainly projects, including stretching piercings, adding additional lobe piercings, etc. Take that into account before you get the piercing done and plan out accordingly. Just understand that now you have this very delicate piercing there that doing drastic things to the area may cause it to, even if you had it for 5 or 6 years, cause it to start having issues. If, even after it heals, if you start noticing bumps, pockets on the inside, discomfort, swelling, etc., go see your piercer. Have them take a look at it. This can sometimes happen with these more longer piercings, and it's always best, when in doubt, have them take a look. And I said this already, but leave the jewelry in at all times. Lastly, let's talk about abandoning the piercing. If the piercing is healthy and there's no signs of infection or other problem, removing the jewelry, whether it's during the healing process or after the healing process, shouldn't be an issue. If it's during the healing process, it'll probably close up pretty rapidly. If it's a healed piercing, it may take a long time for that to look like it's not open. It'll appear open for a long period of time, even after the jewelry has been removed. If it has any type of issues, whether or not it's healed or not healed, if you're feeling bumps, what have you, it's suddenly rejecting, seek advice of your piercer or a medical professional before removing the jewelry. We don't want to create a situation where we're trapping infected tissue and fluids inside the body that's going to require that it be lanced or drained, or it may cause further very extreme medical issues. When in doubt, seek the advice of a professional. Lastly, I always talk about sebum. Sebum is a waxy, oily substance. Well, it's oil because it's oily. That everybody produces. It lubricates your hair follicles. It helps make you watertight. It also collects in crevices and holes, like your abandoned piercing. And then when you squeeze it, it comes out in this nasty smelling cottage cheese substance comes out in like a string, kind of like you popped a whitehead. It's completely normal. It doesn't mean there's a problem. Leave it alone. I don't understand why you're squeezing the piercing in the first place. Well, that's it. Do you have this piercing? Or thinking about getting this piercing? Do you have questions about it? Is there something I didn't cover? Leave a comment. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I would love to see you for your piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in that next video.